Hi, I'm Dr. Peter from Summit Orthopedic Hospital. Today, let's talk about arthritis. Now, what is arthritis? Arthritis simply means inflammation of the joint. However, there are different forms of arthritis that we all need to know. And what are they? We have osteoarthritis, rheumatoid arthritis, infective arthritis, and other different forms of arthritis. Now, this actually affects joints in that the joints will be inflamed, and it could be due to a whole number of reasons, such as what we know as autoimmune, where the immune system attacks itself when we look at rheumatoid arthritis in this case. Or it could even be a non-inflammatory form of arthritis, where we look at osteoarthritis, which is usually age-dependent. The patient would come complaining of joint pain, stiffness, which leads to limited range of motion. Sometimes there will be something we call effusion or swelling, where fluid builds up in the joint due to repeated inflammatory processes going on over time. And then it could also be due to infections. Now, these infections can actually lead to pus in the spaces of the joints. Now, because of all these things happen over time, the joint begins to undergo a degenerative process, needing surgical correction in complicated situations. So what are the things that we can do? The best thing to do is visit your orthopedic specialist in order to make a clear diagnosis of what is going on in that joint. And then at any point in time where time is a factor, or where you are not able to immediately meet your doctor, there are tips that can be given on how to take care of these symptoms. So, such as the use of pain medications like to reduce the inflammatory response. You can also use what we call heat balm or heat spray to increase blood flow to the area of the joint. Then we also have physiotherapy and range of motion exercises that can be done to improve function of the joint. Joints are actually there because human beings tend to move. So your functionality actually helps to preserve the health of your joints. Now, we are not going to go too deep into the different forms of arthritis here, but it's very important that we know the symptoms that present with arthritis, which is what had been mentioned earlier. Pain, limited range of motion, heat, as well as redness or swelling in some severe cases of joint inflammation or arthritis. And then the best things that can be done would be blood tests and other specialized tests to rule out the type of arthritis, and if antibiotics would actually be needed when we have infection in the joints. And we should also note that not all arthritis actually are due to infections, so we should try to avoid use of antibiotics when they are not needed. So that's basically what we would be talking about right in coming videos. In coming videos, we'll touch various forms of arthritis. See you next time.